Welcome to ePathshala once again, subject social medicine and community health. We have been discussing all these days about healthcare delivery system, and we are going to discuss now urban health. Thanks to the principal investigator, Professor C.P. Mishra, and his team from Aligarh University. What are the objectives? When we say define urban health, we are going to talk about urban health. In other words, so now what we want to know is what is urban, what is rural, how do you define urbanization, what are the different reasons for urbanization, how is urban health important, how urbanization affects health of the individuals, what are the common problems faced by urban population, what can be the different measures to improve the health of the urban dwellers, and define roles played by different sectors in improving urban health. What is urban health? Urbanization is the physical growth of an urban area as a result of rural mitigation and even suburban concentration into the cities, particularly the very large ones. Further, for a growing proportion of the world's population, prospects for a better future are tied to the living condition in cities, naturally, because living in urban areas opens a lot more avenues for employment, for living conditions, for lifestyles, for good food, for good education for the children, and general improvement in the lifestyle conditions. So there is a constant migration from the rural areas to the urban areas, and as such, even those rural areas which are bordering the urban cities, soon enough within a few years, are actually considered as part of the urban area due to the sudden explosion of population, urbanization, civilization, and they all become part of the city. Cities concentrate people, opportunities, services, including those for health and education, where fortunes are made and where social mobility is possible. The year 2007 saw for the first time the majority of human beings living in an urban area. And this is because of a large number of people, population explosion. People want to find service opportunities, better living opportunities, better educational opportunities. So they make a beeline, right, even from the rural areas, they make a beeline for the urban areas. For the first time in history, more than half of the world's population resides in urban areas. It is estimated that by 2030, 6 out of every 10 will be living in cities. The rapid urbanization is more to low to middle income countries of Asia and Africa. Now, Southeast Asian region is actually home to more than 1.74 billion people, almost 56% of the world's population. And of these, almost 600 million, or about 32%, live in urban areas. The impact of urbanization on health is particularly important in the region due to the population size and proportion of the urban poor. The WHO actually regards urbanization as an urgent public health concern because, considering urban health as an important issue, World Health Organization dedicated 2010 World Health Day theme Urbanization and Urban Health Matters to urbanization. The urban setting influences health outcomes both positively and negatively. In terms of health, urbanization presents challenges as well as opportunities. A word about urban health. It's not only we are related with the health concerns, but the fact that people are shifting, they prefer to live in the urban areas, has, as we have already said, positive factors plus negative factors playing a very important role in their lifestyles. Now we see that many of the areas which are growing urban, and that too on the borderlines of the city. Now, for example, Bombay has one of the biggest slums in Asia, that is the Dharavi, and yet it is positively a very organized slum area which has got a water supply, which has got all possible facilities and amenities, except for the fact that the people sometimes live in small um, huts made of tins, made of wood, made of covered with plastic coverings, and they are non-permanent type of structures. But they do live there. Their life goes on. They are earning money. They are giving place to families, and education is being presented. But urbanization itself presents a challenge to the life opportunities. Why urban health matters? Urban health issues are actually highly relevant for the following reasons. First, with the majority of the world's population now living in urban areas, and this proportion is expected to grow. The United Nations projections are that more than 35% of the world's population will live in urban areas by 2025, and urban health should now become the major focus of global public health policy. Second, much of the natural migration growth in urban population is amongst the poor. More than 1 billion people, one third of the urban population, lives in overcrowded and life-threatening conditions in urban slums and informal settlements. And if cities fail to deliver on the perceived promise of economic opportunities for the poor, large concentrations of unemployed young people may threaten social stability, security, and health of the communities as a consequence. Now, the question is that urban health, although it can be regulated, yet it presents more challenges than the normal acceptance, because it is not only the health factors, it is the law factors in terms of criminal activities, in terms of drugs, in terms of smoking increase, in terms of unsocial elements, gathering of unsocial elements, and gathering and running of unsocial clubs. For example, prostitution becomes thrives, selling of children thrives. So all these type of unrequired and unwanted items also come on the agenda of urban health, and it is very difficult to penetrate into the mesh fold of these urban health or urban slum communities in order to give any sort of protection or stability to the urban life. Thirdly, there is evidence that rapid and unplanned urbanization can have negative consequence for the health and safety of the people. Definitely, this is what we've been talking. That apart from giving them a regular lifestyle, it is more of a dangerous lifestyle because their fear never goes away. Safety is never a matter of safety, neither in the daytime nor in the nighttime, is a matter of concern for any of the public health authorities, and acceptance of other useful items, that is provision of water supply, provision of safe drinking water supply, provision of good food, provision of health services per se is important. Besides the seemingly inevitable degradation of the physical environment that rapid urbanization tends to produce, there are also a plethora of human behaviors that tend to be affected. This is exactly what I've been saying, that once urbanization starts because there is a need to improve oneself. There is a need to connect with the urban environment, to become cityfied. And as such, so we need lights, so every time an item enters this extended urban environment, we are going one step backwards because there are larger number of people, larger number of interactions, and not many of them are pleasant. Now, what are the issues related to urban health? Urbanization actually impacts the population health. It is but natural that urbanization is going to impact population health, because living in such large numbers, in such close quarters, and in such close and crowded slum dwellings is definitely going to increase a large number of infectious diseases. So it could be skin diseases, it could be lung diseases, and because of the different lifestyles, cancer could be on the increase, and because of the lack of healthcare being available to each and every corner of this newly urbanized population. Therefore, what matters is that they have to go in search of those healthcare providers who are available within that gamut of inexperienced mobile population. And since this is a mobile population, it is important to know that as each one goes and comes back in, they filter in, they are bringing with them certain habits which are not very healthy habits, certain diseases, certain lifestyles which they spread to the younger population, which is actually affected by the younger population on a faster basis, and as such it spoils it creates an imbalance of the balance of health as well as mental health. Urban settings are actually a health determinant. There are unfair differences in the health of the city dwellers. Definitely, because some of them don't have place to live, some of them have huge gardens, some of them don't have water to bathe, some of them are having water to sprinkle over their lawns and over their huge houses. Some of them have big roads. Some of them are just living in houses in which you can hear the next person who is living in the next. Now, there is multi-factorial vulnerability in the slums. And what are the factors? Factors such as housing, services, land status, location, and access and use of public health services. Then the hidden and the unlisted slums are also there. Past infrastructure interventions, alcohol, gambling joints, gender inequality, negotiating capacity. And what are the situations which are affecting the vulnerability in the slum? That is permanent, less permanent, not permanent materials, separate cooking space, ventilation, overcrowding. So none of this is actually available in the quantities or in the quality in which it should be available. In services, you have mostly water supply also not maybe in pipe form or maybe in tank form. Toilet is there, drainage is insufficient, and flooding is there, and electricity is there, but there are more dangers due to the electricity because of the uncared for wires which are running haphazardly through the entire slum areas or the urban areas. Then the land status, even these are actually very secure or insecure land tenure. Nobody knows for how long this little hut is. Maybe it is for 1 year, maybe it is for 5 years. And location on the municipal government land, or is it on a private land? If it is on a private land, all these houses are akin to being rubbed out if the moment the private developer comes in. So hazardous locations are there, and they could be in the low-lying areas also. Access and use of public health services. Lack of access to primary healthcare, hospital services, poor quality of health services, nutrition, food security services, all these are there. Hidden and unlisted slums may be there. That is, many slums are not notified in the official record and remain outside the purview of the civic and health service. So they have to fight, they have to snatch, they have to steal electricity, they have to steal water supply, and yet they are not permanent residents. Vast infrastructure, intervention in the slums, and besides, these people are always have the fright that any day they come, their houses could be wiped out. Vast infrastructure, intervention in the slum. If an infrastructure project has also been implanted reasonably well, some slums have better roads, community halls, and other infrastructures, while most of the slums do not have any of these facilities. Alcohol and gambling join gender inequity. These affect the extent of the depletion from alcohol, domestic violence, gender inequity, uncomfortable social environment. So because all sorts of social miscreants are available in these areas, and because all the time, morning, noon, and night, smoking, drinking, gambling, all these are there available on the roadside, and they are in the eyes of the regular passerbys. So, with the result that any woman, any child passing by is going to learn that this is the life which they have seen growing up. So, then negotiating capacity, lack of organized community, collective effort. Now, when they are living in such difficult circumstances, there is no possibility of the entire community getting together to have one collective effort or to have one collective voice. And the absence of such an active, aware individuals who can be the voice of the community. This is very important and very correct. Then urban health in the Indian context. India also has amongst the world's largest urban population with below poverty line incomes and the world's largest population living in the slums. In 2004, 2005, 80.8 million urban dwellers, that is 25.6%, were below the poverty line. The largest and because they are below the poverty line, often these people have to emerge out of their quarters in order to earn money, to earn bread, and as such, thieving, non-social, mixing with non-social elements, and prostitution, gambling, all and criminal activities, all this will become part and parcel of the daily horizon. The largest concentration of urban poor population were in Maharashtra and UP, 11.7 million, Madhya Pradesh, 7.4 million, and Tamil Nadu, Karnataka, and Andhra Pradesh, each with between 6 to 6.9 million. Urban population growth in India. Now, this is a chart which is showing how steadily there is growth of urban population in our country, right from 1951 to 2026. It is expected that it will reach this big amount, and percent urban, maybe 600 million. Nothing. Okay, during the 20th century, urban population multiplied more than 10 times, and this is too rapid a growth, and we have to match this particular growth of the population with the growth of the facilities which are available with us, which is not possible. Therefore, we can expect a lot more disasters, natural disasters occurring as a result of this super explosion of population and urban growth. And urban population projected to reach 535 million by 2026, first quarter of the 21st century, which is too much. And it had started from just 17.3 million. 17.3 million, it has gone up to 535 million, which is unbelievable. Now, the urban 5 MR India was 73 per thousand live births. This is maternal mortality in the poorest quartile, and 42 per thousand live births in the rest of the urban population. And that means that these have to be worked upon in order to bring them down to the lowest level. That means, in spite of the urban population projection, we should not be losing mothers and children at any cost. In 2005-2006, 54% of the children were stunted and 47% underweight in the poorest urban quartile, compared to 33% and 26% respectively for the rest of the urban population. Then only 54% of the pregnant women had at least 3 antenatal care visits, and compared to 83% for the rest of the urban population. That means there are no services which are available even for the MCH in the MCH sector or in the reproductive child health services. They are getting absolutely insufficient services. 81.5% did not even have access to piped water at home. 52.8% did not use a sanitary flush or a pit toilet. Means they have to go for open field defecation. And this piped water we see often in the movies and we see in the documentaries, people making long lines, or they are putting their buckets and the water containers in long lines right from the early part of the latter part of the night or the early part of the morning, and the water comes for only a small while, and in that particular time all the water has to be collected and put for regular use. The proportion of the population living in the slums and the proportion living below the poverty line are both around 25%. A high proportion of the poorest urban quartile in India and in each state is likely to live in the slums and unlisted poverty clusters. However, slums, including unlisted poverty clusters, have the highest concentration of poor people and often the worst living conditions, especially if efforts are made to include a more accurate count of slum dwellers. Recommendations to improve urban health. Promote urban planning for healthy behavior and safety. Improve urban living conditions. Ensure participatory urban governance. Build inclusive cities that are accessible and age-friendly. Make urban areas resilient to emergencies and disasters. This is all very well to recommend, but is it really possible that this can be done? So let us see how. Urban health planning. Urban health planning is a very good motto, and we have to follow under this. Let us see what are the rules, different rules which are played by different people. Ministry of Health, they become more informed about the social determinants of health and how urban policy choices impact health and development. B. Engage other sectors including housing, transport, industry, water, sanitation, education, environment and finance agencies. See, because this is a teeming, living organization, as such it is important to know that every single bit of the social circle, of the financial circle is important and it will be available there. Unfortunately, how these circle to impact the living standards and the conditions in the urban areas is a matter of concern. Lead by example by supporting healthier and more livable cities. It's very easy to put it into writing. Unfortunately, when you see the real conditions, they are horrible and they are very difficult, giving difficult lifestyles to those living in those places. Today, there is no place available. If places are available, there are the land as well as the quarters as well as the flats are very expensive, much beyond the pocket of the ordinary person. Support health and environmental impact assessment for urban plans and policies. Now, amongst the urban health policies, people have started, the government has decided to take land to build small living quarters for these people and allocate them. Then we have people shifting into these and they have their own problems of falling cement because they have been again difficult situations arise between the contractors and the developers. So, as such, the end result is that they make money amongst themselves, but the end result are those flats which are totally non-livable. Show leadership by providing role models and by setting an example. Partnership with NGOs, professionals, and community organizations to provide input on planning and transport plans. Share information and set up mechanisms for sharing data on active living across government departments with civil society and community. Encourage and enable community participation. Most important, but these are good points to make and good points to follow, to set. But the thing is that with this explosion of population, explosion of living situation, explosion of the sentiments of these people who are living, working and working hard to make a living for themselves and for their families under such difficult circumstances shows that urban health is not a very easy subject. It is not very easy to deal with. So therefore, what to do? We have to still encourage and enable community participation so that some form of relief may be there. The civil society ensure that the people are fully engaged in shaping the policies and programs that affect their lives. Include residents of the informal settlements in formal processes by setting up groups, associations, and federations to find practical solutions to these problems, to struggle against marginalization, to ensure access to the goods and services to which they are entitled. Then we work with the government on participatory planning and budgeting to allocate a greater portion of the municipal investment budgets to priorities. In other words, we have to make way and we have to work continuously in order to build a civil society even with the urbanization en route. Researchers generate and systematize knowledge to address the many existing information gaps, which are including potential advantages of urbanization and urban growth. After all, there must be some advantage. So, what are those advantages? The inequities of health disaggregated by intra-urban area and the importance of involving all citizens in the decisions that affect the habitat and health. Then the role of the international agencies, promote and support policies to promote healthy environment, support women's rights and poverty reduction, equity promotion, promoting strategies and programs, encourage policymakers to generate and use socio-demographic information to make better decisions regarding the urban future. And lastly, the National Urban Health Mission. This is need-based, city-specific urban healthcare system to meet the diverse healthcare needs. It's very important because this mission was created in order to look after the blooming urban population and its problems. Institutional mechanism and management systems to meet the health-related challenges, partnership with community and local bodies, involvement in planning, implementation, and monitoring of health activities, availability of resources for providing essential primary health care to the urban poor, and partnerships with NGOs, for-profit and not-for-profit health service providers, and other stakeholders. So, urban planners use the zoning and the land use regulations as a way to prevent exposure of city dwellers to pollution, emissions. At least some control must be made to give them a healthy lifestyle, and hazards from the industrial waste, activities, chemicals, as well as transport. Then develop and adopt building practices that protect health amongst the building users. Build compact cities where dwellers have easy access to green areas, public transport, cycle paths, health, education, and other fundamental social services. And to summarize, urbanization is the physical growth of urban areas as a result of rural mitigation and even suburban concentration into cities, particularly the very large ones. It is estimated that by 2030, 6 out of every 10 people will be living in the cities. This rapid urbanization is more pronounced in the low to middle income countries of Asia and Africa. The impact of urbanization on health is particularly important in the region due to the population size and proportion of the urban poor. The urban setting influences health outcomes, both positively and negatively. In terms of health, urbanization presents challenges as well as opportunities. Virtually all population growth over the next 30 years will be in the urban areas. They will grow horizontally in the form of an urban sprawl, whether as suburbs in the developed world or as peri-urban expansion in the developing world. Thank you for visiting ePathshala.